moving on to the first session, which is our first topic today is challenges living with ADHD. So, as you're aware, attention deficit hyperactivity is, just a second, attention deficit hyperactivity disorder, or ADHD, is often misunderstood as simply being restless or inattentive. It's a condition that can affect focus, organization, and even daily routines. For children, it may show up as struggles in school or difficulties sitting still. For adults, it can mean challenges at work, in relationships, or simply in keeping life organized. By opening up this conversation, we want to understand what it's really like to live with ADHD, break the myths around it, and talk about what's the right support and awareness by which we can make a difference. Our moderator for this session is Dr. Sachin Ganorkar. Dr. Sachin Ganorkar is a physician, a health administrator. He's a PhD from TIS and the co-founder of FAVMI. He has 21 years of experience working in healthcare, and his primary interests are primary care, mental health research, and health technology. Over to you, Dr. Sachin.
Yeah, thank you, Saraswati. A warm welcome to all. Thank you, Sunita Golait, madam. I would like to warmly introduce our panel. First is Dr. Avinash Desousa, Dr. Kersi Chavda, and Ms. Shalinee Sahoo, who will be the panelists for this session. First, I would like to warmly introduce Dr. Avinash Desousa. Avinash Desousa is a consultant psychiatrist and a psychotherapist and has his clinic in Santa Cruz West, Mumbai. He is the founder trustee of Desousa Foundation, an organization he works in the area of mental health awareness across all the sectors. He has over 950 publications in national and international journals. He is an academician, consultant, researcher, speaker, and postgraduate teacher, besides jogging his time as a dutiful husband and a doting father. His Instagram handle is at Desousa Avinash. His LinkedIn handle is Dr. Avinash Desousa. I warmly welcome you, sir, to share your thoughts on what is ADHD and what are the challenges of living with ADHD. Thank you, sir, for your time. Thank you, everybody.
Am I audible to everyone?
Yes, sir.
Yes, sir, you're audible.
Yes. So in the next 7 or 8 minutes, what I intend to do is just give you my perspective on ADHD. Well, we're talking here about ADHD is a disorder seen across the lifespan. We see this in children, we see it in adolescents, we see it in adults. And a lot of people believe it's normal for children to be a little hyperactive, and it's absolutely fine. But of course, when this filters into adolescents and in adults, then it becomes a big worry. Around, I think, if you go into any classroom in any school, and schools is an area that I work with, you will find that at least 10 to 15% minimum children have hyperactivity as an issue. Now, when we look at hyperactivity, there are two aspects. One is the inattention, that is not being able to pay attention. The child is distracted, his attention span is low, and as a result of that, he is unable to focus, and he may not copy down notes properly. He may lose things in the class. He may be distracted and disturb the teacher. He may answer out of turn. He may not want to stand in a line. Sometimes they get impulsive. They may push another child or shout or scream or whistle or do anything which could, disturb the class. The second component, of course, is hyperactivity, where he doesn't sit in one place. He's very fidgety. He's running around, and that's the more difficult part to control. At the same time, we also see this. Earlier, people used to think that by the age of 12 or 13, this ends and we don't see ADHD anymore. But now we are seeing an adolescent version of ADHD where the hyperactivity component is not so much, but the inattention, the lack of ability to focus filters into the secondary school years also. And we see a lot of children in 8th, 9th, and 10th, and 11th and 12th, particularly below the age of 18, that face a lot of problems in focus. They get distracted very easily. And they're very often brought to us with the fact that though the child is intelligent, his academic scores are declining, and there is no evidence of learning disability or any other problem. So very often we diagnose adolescent ADHD also very often. Now, the worst part is that we have to treat ADHD as soon as we see it. I'm not going to be discussing the treatment aspect or the drug aspect because this will be done by Dr. Chavda. But the thing is, you have to treat early, because when you treat early, only then will you have results early, and you'll probably alleviate disability which would last a long time. But in many children, this is undetected. In many children, parents are unaware, schools are unaware, teachers are unaware, principals are unaware, and it's not detected, and it goes on through their academic years. And finally, it presents to us later as adult ADHD. And in adult ADHD, what happens is that the person is inattentive, he procrastinates a lot, he's not able to focus at work. And there are other components like mood swings. They may tend to use alcohol or cigarettes or any other drugs as a method to cope with their problems. Sometimes they may get violent or aggressive. And so you have a lot of other psychiatric disorders that develop. In fact, not treating childhood or adolescent ADHD puts them at a risk of substance use in later life. It puts them at, at a risk of developing bipolar disorder in later life. So it's very essential that we nip this in the bud and treat it. Parents and family members have to also be psychoeducated that this is a serious condition and it is not something which is to be taken lightly. You have to visit your doctor again and again, and whatever interventions are suggested need to be done. Teachers need to be aware that it's a common problem. Certain classroom modifications may be made. The child has to be referred, which is very important. So instant referral and instant diagnosis is very important. And I often tell parents that, yes, ADHD is a mental health condition. ADHD is sort of psychiatric condition, but it doesn't mean your child has a psychiatric disorder. Don't look at it as a disorder. It's a condition which we now label as being neurodiverse, and we don't look at it even from a disorder perspective. So we're looking at it as a neurodiverse condition, and one where help can be sought and help is available. You just need to go to the right professional at the right time, get assessed, and seek help. And we tell all children that you have ADHD. ADHD does not have you. Thank you.
Thank you, sir. Thank you for
Thank you.
sharing your thoughts. This is to thank you. I think that was a good start. This is to warmly welcome Dr. Kersi Chavda. Sir has been the past president of the Bombay Psychiatric Society. He is a consultant at PD Hinduja National, Hinduja Healthcare, and Sir H.N. Reliance Foundation Hospitals. He had been and currently is the chairperson of the task force of the Indian Psychiatric Society dealing with school psychiatry and counseling. He was the chairperson of the task force of the IPS, Indian Psychiatric Society, dealing with LGBTQ community. He was a panel member of the task force that laid down clinical guidelines for treatment of autism spectrum disorders. He had been the chairperson of IPS task force dealing with college psychiatry. He has been involved in a lot of fields of interest as kids, and he has been a part of the first panel of the Maharashtra government that had laid down concessions for learning disabilities in Mumbai. He has written a chapter in 4 books. He has been a TEDx speaker. His Instagram handle is at Chavda Kersi. A warm welcome to you, sir. Thank you very much for your time.
Thank you. So I'm supposed to be speaking about something to do with attention deficit disorders. And since Avinash has already spoken about the overview of it, I figured that I'm going to get into something related to the medication and related to the treatment, because it's not enough just for us to be able to diagnose it. It's essential for us to do something about it. let's also look at it like this, that you start off with it basically being an inattention, you're restless, you might be occasionally aggressive. And over a period of time, no kid wants to be with you. No kid wants to play with you because you can't follow rules. You go down to play cricket and very often you just bat, and then when it comes for your time to field the ball, you'll walk away. So these people end up also having social alienation, which is very well known. Because of the impulse control issues, which is a very important part of attention deficit disorder, they'll end up doing things on an impulse. So you have a kid who's walking down a staircase, another kid comes and touches him by mistake, and on an impulse, this fellow will throw the other guy down. Causes a lot of problems, causes a lot of parental anguish, causes a lot of teacher issues, causes a lot of principals saying we can't manage him over here. And of course, we have to fight this because, like Avinash said quite correctly, this is just neurodiversity, and neurodiversity needs to be looked at. We're also looking at anything between about 12 and 20% of the population having this. So if you're going to have these kids drop out of the education system because they can't be looked after by so-called normal schools, then we're going to have a huge gap of millions of kids who will not be properly educated, and then they'll end up doing things which they would not have done if they had proper education. Now let's look at treatment. For the younger child, one would probably start off with occupational therapy and something called sensory integration. So you have to find a good occupational therapist, preferably a pediatric neurodevelopmental occupational therapist, and then you'll end up doing sessions with that person. Now, rule of thumb is you might go once a week, once in 10 days. Most of them, in fact, all the good ones, will give you a home-based program. And there is a lot of research which talks about the fact that the more you can do those exercises with the kid at home, the better is the overall result. Now, I understand that families, especially nuclear families, find it very difficult. Mom and dads both work. They may have another child. It's difficult to give that much of time to this kid who has attention deficit. But the bottom line is, if you're looking at a recovery, and we all want our kids to recover as soon as they can, or at least to be better behaved as soon as we can manage, we've got to work on a war footing. So get neighbors involved, get friends involved, get the kid to constantly do the exercises that the neurodevelopmental educationist talks about, and that is very, very, very important. When I was a medical student many years ago, we talked about diet. Diet today has been disproved. Of course, it's healthy not to eat too much of sugar, not to have too much processed food, not to have additives, to have everything as fresh as possible. But how much effect it actually has on attention deficit disorder is a moot point. Of course, you will have kids who, if they've been on sugar restriction to some extent at home, they go for a birthday party and they have a glass of Coke, and then they eat ice cream, and then they have a cake, and then there's a sugar rush and they go absolutely berserk. But we are not absolutely certain as to how effective it is just to restrict sugar. We do know that as far as possible, processed food should be avoided. Food which has additives should be avoided. So we should land up making as much of fresh food as possible. So don't have Pringles and don't have Lay's chips. Chop up potatoes and give it to them fresh. Don't have Cokes and Pepsis, have fresh fruit juice, that kind of thing. Point number 3. Before you go to school, especially if the kid has a morning school, it's a good idea to get him up 1 hour early and then to make him do a lot of physical activity. So he's not absolutely fresh in school. So the poor teacher also doesn't land up putting her hair out. You must remember that schools, by and large, will have a lot of attention deficit disorder. And it's very nice for us to pontificate and say that schools must do this and schools must do that, but it can be very difficult for a teacher. If you have about 3 or 4 kids with attention deficit hyperactivity in one class, it's very difficult. One of the things that's known to help is to reduce some of that initial energy with which they wake up. So for about an hour in the morning, if they can do some physical activity, they'll end up going to school. Of course, they'll still be energized, but maybe that excessive activity, energy, rush, whatever you might call it, will be a little subdued, will be a little less. So it becomes easier for them to be treated, to be looked after in a school. Now we come to the medication, something that frightens everybody. there are two main kinds of medication. There's something called stimulant therapy. There's something called non-stimulant therapy. If you're looking at non-stimulants, the commonest one that we use is something called atomoxetine. If you're looking at stimulants, the one that we use is something called methylphenidate. They come in immediate release, delayed release, and depending on how you want the child to be given the medication and what time he goes to school and what time he maybe has tuitions later and so on and so forth, we would adjust the dose. People get scared of medication. Why would I give my child medication? Can't I do some other stuff? Can't I do Ayurveda? Can't he do meditation? Will yoga help? Well, for what it's worth, you can do all of that, but at the same time, the mainstay of attention deficit disorder seems to be related to the medication. I'm not pharmacy driven. Let me say over here that even though I might be one of the biggest prescribers of methylphenidate in the country, I do believe that it has an important role, and I have lost count of the number of times I have suggested it to a parent whose kid is in, say, the 6th or 7th, and they say, no, 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 and then they come back to me in the 9th and the 10th and say, please, please, please. So we are not nitwits. We are not idiots to just suggest it. We also have kids. We know what medication is all about. It's a good idea to go to a guy who knows what he's doing and then take whatever be the options available. So like I said, if they're non-stimulants, we're looking at something called atomoxetine. If there's a stimulant therapy, we're looking at something called methylphenidate. Abroad, they also use amphetamines. Amphetamines are banned in this country. We have another thing which is called clonidine. This is actually initially started off by being an antihypertensive, which means we use it for blood pressure. And they found that it had a good effect also on some cases of attention deficit, and it also helped with sedation. So if a kid who had attention deficit was not sleeping at night, sometimes you give the clonidine, and it helps the attention deficit. At the same time, it also enables him to sleep better at night so that the whole house gets some respite. Today, we also use something called modafinil or R-modafinil. These are things which have now started being used, which we give in the morning especially, and it seems to have a calming effect on kids who have this kind of a problem. What are the commonest side effects? Because everybody is very, very frightened of them. One of the things that we would probably do right in the beginning is to rule out things like vitamin deficiencies. If he has a vitamin deficiency, you have to deal with that. If he had a problem with the liver, you deal with the liver. If he has a cardiac issue, one is very, very careful about giving medication. In fact, probably the most important thing that we do before we start the medication of stimulants and even non-stimulants is to do a proper cardiac history, is to get a proper cardiac history. If there is a very strong cardiac problem in the family, it's a good idea for us to evaluate, even take a cardiogram or do an echo just to be on the safe side, because this medicine is known to sometimes cause a problem in the cardiac realm. Now, when I say sometimes, it might be less than 2%, but I wouldn't want to have that 2% which causes a problem. We're looking at the other side effects. One of the commonest side effects of both the stimulant and the non-stimulant is actually lack of appetite. And especially for Indian mothers who believe that their kids have to eat and eat and eat, and they must put on weight and weight and weight, khata pita, family, etc., etc. If you suddenly find your kid not eating properly and losing weight, then the doctor is the worst person in the world. So we have to make it clear that if the child starts losing weight, yes, we'll have to stop the medication. If I have, in 100% of cases, I might have had to stop the medication in about 4 or 5% because the kid has just stopped eating. I mean, I certainly don't want the kid to starve, but sometimes you have these huge, rotund little kids, and not eating would probably be beneficial to them. The third thing that is known to also occur is headaches. So especially if there's an increase in headaches, it is something that we have to deal with. I certainly don't want that the child, in this process of getting control over one problem, ends up having headaches. This is certainly not what we are looking at. This is certainly not acceptable. So we would do whatever we can in order to reduce it, if necessary, even change the medication or try something else. It is essential over here that all kids have to be hydrated properly. Most kids don't drink enough water. It is essential for us to do that. Most kids don't eat regularly. and breakfast is an absolute must. The amount of kids who go to school on an empty stomach is ridiculous. It should not happen. They have to eat something. Even if they leave the house at 5 in the morning, they have to eat something and then go to school. That is again something that we look at. There used to be this whole thing of can stimulants and non-stimulants cause tics. So a tic is a movement like this. It's an involuntary movement. There was a lot of research that went into this. Yes, stimulants can cause tics. Today it's been disproved because we know that just because it is there doesn't mean it's the cause. For example, supposing I sneeze and it starts raining doesn't mean my sneeze causes the raining. So just like that, if I start you on medication and the left nostril starts to scratch, doesn't mean that what I have given you causes a scratching sensation in the left nostril. Latest research shows no, there doesn't seem to be too much of a correlation between the medication that we use and tics. But to be on the safe side, we take a history anyway, and we just tell the parents that if you do by any chance see an increase in tic activity, please let us know, and then we think of something else to do. Occasionally, the child, in addition to having attention deficit disorder, also ends up having comorbid disorders. So he's very aggressive. And even though the medication we use will reduce his attention deficit, will enable him to focus better, will reduce the impulse control, there are times when we need to use other medications to reduce his aggression. We need to use other medications to reduce his screaming and shouting, because we must remember that attention deficit can be comorbid not only with a kid with normal intelligence, but you can have a kid with intellectual difficulties who also has attention deficit. You can have a kid who's in the autistic spectrum who also has attention deficit. You can have kids with oppositional disorder who also has also has attention deficit. In which case, then we need to add other medication in order to control it. And I'm certainly not saying that medication is the be-all and end-all of everything, but I'm certainly saying that it's probably one of the most important things. So we would, of course, counsel the parents. We do therapy. We do behavioral therapy for the kids, where we'd focus more on positive behaviors rather than negative and reinforce positive behaviors rather than negative. All of that would happen. But I think what I'd like to leave you with is the necessity of knowing that let not your bias come in the way of your kid getting proper treatment with medication. You also need to go to a guy who knows what he's doing. I mean, sometimes I have people who say, but I went to my uncle's somebody, and if he's not a psychiatrist or maybe even a neurologist, then I think we need to go to somebody who's a little more aware of the condition, rather than somebody who gets everything only from social media, which is the biggest bane that we are facing. The stuff that you read on social media is nonsense, most of it at least. We have very categorically said that stem cell therapy plays no role in attention deficit disorder. In fact, it doesn't even play any role in the autistic spectrum disorder, which is used for much more. So I am again categorically saying that sometimes parents, in their frenzy of doing the best that they can, land up taking recourse to things which unfortunately play no real role in whatever the treatment of the disease that they're dealing with. So we need to do whatever we can to go to the right person, get the right medication, get the right treatment, do the right occupational therapy, give the correct support to schools, and then hopefully things will become better. Thank you.
Yeah, thank you, sir. I think that has been very, very comprehensive. And it's almost like an encyclopedia speaking to us, given your vast experience and the way actually the disorder has to be seen. Even we as people who have families and even in the field of medical education, we find it very difficult to understand what actually ADHD is. And I think from your side and Dr. Avinash have explained it very, very well. So thank you. We'll also invite Ms. Shalinee. Ms. Shalinee, are you there?
Yeah, she's there.
Yeah.
Yes, hi. Good morning.
Hi, good morning. So thank you, Dr. Kersi. Thank you, Dr. Avinash. So we'll just also invite Shalinee. Ms. Shalinee Sahoo is a young girl and an ADHD warrior. We are really grateful to her that she was ready to share her perspective of the real life challenges of ADHD, which often go unnoticed. Hi, Shalinee. This is to invite you so that you can share your thoughts.
Thank you so much. I'll be sharing my screen. Please let me know once it's visible. I've prepared a small deck, so I'll be able to help myself understand to everyone that what exactly I go through on a
Sure.
day-to-day basis.
Sure.
Sure. Yeah, your screen is visible, Shalinee.
Yes, all right. So thank you for this thank you for this opportunity. Thank you for joining in today, especially on a Sunday morning. So I'm Shalinee and I'm here to talk about something that I discovered about myself. As something that explains a lot about who I am, how I think, and how I feel, which is ADHD. It stands for Attention Deficit Hyperactivity Disorder. And this is something I'm doing for the first time, so I'm actually feeling nervous. So please feel free to drop in questions, if in case you have anything. Yes. So moving forward, the self-discovery moment, it was, I realized it until last year while having a very candid conversation with my best friend who also happens to have ADHD. As I shared my everyday experiences with her, like how my mind constantly jumps from one thought to another, how I get too emotionally invested in things, how I sometimes spiral into impulsive decisions. She simply said, this sounds so much like ADHD. And that one sentence changed my life forever. Yeah. So, ADHD is often misunderstood. People actually think it's about being distracted, restless, or disorganized. But for me, it's like having 10 browser tabs open in my brain all at once. All of them are playing some kind of music in the background. It's not exactly lack of attention, but it's simply, to put it out there, it's too much attention to everything. It's noticing 100 things at once, but also struggling to focus on just one thing. It's caring deeply about something one moment and suddenly just losing interest the next moment. On a day-to-day basis, the everyday struggles, that happens is the first thing is addiction, and no, I don't mean it in the wrong way, but if when I finally find something that I truly care about, I really can't stop. I just go all in. It's either, everything or nothing. It can either be, it's related to work, a person, a hobby. I just go all in, and that's very beautiful, but also very scary at the same time. The second challenge is emotional regulation. My emotions are just all over the place. Sometimes I have my emotional high, sometimes it's just low, and that is the hardest part. I feel things deeply. A small disappointment can hit me like a big storm, and a small compliment can just lift up my day. The third challenge is being impulsive. The sudden urge to just say yes without having thought anything through. It's very exciting to chase that adrenaline, to chase that excitement, but it can also be very mentally exhausting when you sit and think about it, that why did you do this the certain way that it just happened. ADHD shows up in small, invisible parts of life. So, in my daily routine, it actually means that I need structure. I need the discipline that helps me, keep going. For example, if I skip my morning routine, if I don't have my coffee, it just makes me go mad. So there are certain things which has actually helped me, cope up. The first one being, routine has always been my anchor. Small rituals like exercising, making my bed once I wake up in the morning, journalizing, or just planning my next day well in advance. Discipline is what keeps me going. It helps me calm the chaos. Therapy has helped me reframe my self-talk to see that ADHD is not as a weakness but as a strength. A very important part, for ADHD warriors is firstly accepting ADHD and being aware of it. So, this is what I've learned, that ADHD isn't all challenges. It also brings a sparks that's very hard to define to most of the people. But, when I hyperfocus, I can achieve things that I never thought was possible, which is very inspiring in itself. Also, when I connect with people, it's actually very genuine, deep, and full hearted. So it's very important for us to embrace our strengths and quirks and not just focus on, our look at it as a weakness. Then moving forward, so this is a message to all the peers and all the audience I have out there. If you don't have ADHD, here's what I wish you understood: that no, we're not lazy, we're not careless, we are not overreacting. We just process the world intensely and sometimes too intensely. A bit of empathy, patience, and understanding from others can actually make a world of difference. To anyone living with ADHD, I see you. You're not broken, you're not behind, you're not too much. Yes, your brain might be wired differently, but it's still brilliantly yours. Uh, I actually don't let ADHD define any of me, but it has definitely taught me a lot about self acceptance and resilience. I have actually stopped chasing normal. Instead, I have started building a life that fits me. And if there's one takeaway I want to leave you with, it's this: the goal isn't to fix your brain, it's simply to understand what you're going through every single day. Thank you.
That's wonderful. Thank you, Shalinee. I think that's a very candid sharing, and we are very grateful for you to share your experiences and also crystallize it in the form of a presentation. So thank you, Dr. Avinash, Dr. Kersi, and Shalinee for sharing your thoughts. We would like to open this panel for questions, and I saw one question from Akhila saying that she's asking, can we grow out of ADHD? I would request Dr. Avinash or Dr. Kersi to actually comment on this. And how can we make children eat early morning if they are not hungry?
How can we make children
Eat.
Eat early morning if they are not hungry?
Well, I think the first thing is, it's not about growing out of ADHD. It's learning to live with it, and making modifications so that we're able to manage our life with the deficits that are seen. But so we can have modifications in our lifestyle that can help us remain with ADHD. When it comes to how do we make children eat, I think you have to give them things that they like, and if you give them things that they like, they'll definitely eat. So if you wake them up in the morning and tell them to have chapati bhaji, they're not going to be very happy to have it. So there has to be things which food has to look attractive, colorful, some effort has to go in. So, and the previous night you can discuss with them what they would like to have in the morning, so that the early morning fight and the tussle over breakfast doesn't start. I think Dr. Chavda can add here.
Yeah, I could. Now, the other thing is that, like Avinash had said during his talk, we have to remember that there is something called adult ADHD as well. So when somebody is saying, no, do you outgrow it? I think it's extremely unlikely that you'll outgrow it. You'll just have a different form of it. So what normally happens is that you wouldn't be very hyperactive as an adult. But if you're looking at a guy, you might find that he's very restless. You might find that he's constantly, you give him a book to read or something like that, and he'll be able to read the first 2 pages, and then he'll kind of get very distracted. If he's married, very often his spouse will say, I give him 5 things to do, and he remembers 3, and then he forgets 2, and then he comes back and said, oh God, I forgot. Now, all of these is not because the spouse doesn't love you. It may be because he had attention deficit disorder. So we've got to be aware of the fact that attention deficit disorder just does run in adulthood. It's very likely also that the inattention might come under some element of control. The hyperactivity certainly comes under some element of control, but very often the impulsive issues persist, and they can be if not treated, they can actually be the cause of a lot of marital disharmony, bad parental. You become a parent when you got this problem, and then you are not a very good parent because you react in ways which you would not normally have reacted to if you had some control over whatever impulses have triggered you. What was the second one? The second one was, what was the second question?
How do you make children eat in the morning?
Okay. Now, to make children eat, you have to have breakfast. There's a huge amount of parents who don't have breakfast. And then when you sit down there and you pontificate and say you must have breakfast, the kid is going to look at you and say, where are you having breakfast? And for God's sake, breakfast is not a cup of coffee. The absolute least that I permit is a bowl of fruits. And I keep emphasizing bowl because initially when I would say fruit, and then the guy would come and say I had 2 grapes. So we are talking of a bowl of fruit. We are talking of kids who need to eat. There's the other thing also related to the fact that initially it could be difficult, especially if the kid is not used to having the food that, he's not used to having food in the morning. But what you just need to do is to persist at it. I know that it can be very difficult initially, but if you persist at it over a period of time and not give in to tantrums and not give in to I hate you and not give in to I wish I was not born in this house, I think over a period of time, the kid will realize you mean business and he'll start eating. Important thing, you don't get angry. I mean, if he shouts, you don't shout louder. Then you've really lost the battle.
Thank you, Dr. Avinash. Thank you, Dr. Kersi. Shalinee, any thoughts from your side based on your lived experience?
I think what Dr. Kersi said was very rightfully said. We actually don't have to see it as a struggle, but as a strength. I mean, everything in life does have its pros and cons, but it's just that, you have to accept it and just be very positive about it, because it does have a million of positive things that ADHD gets you, and this is something that you'll have to be living with it all your life. So I think the most important thing is just informing your loved ones. I mean, I didn't know until I was 26, 27 years old. But what I have done as a major step is I've just informed all my friends and my family members that this is something that I do have. It might not be, you might not be able to understand since you're on the other end, but this is something that I'm going through. And some kind of empathy, patience, and love is what I required. So yes, thank you.
Oh, thank you. So there's a question from Mr. Amar Shah. Do the medications given to ADHD kids wean out over time, or is it for life? And there is another question from him saying, how to make the ADHD kids make friends? She is a loner and it results in her getting bored. And we parents need to be with her in the evening, else she's stuck in a room all evening.
I think let Dr. Chavda take the medications question. I'll answer the other one. Yeah.
So if you're looking at medication, like I said, it's very likely that the person will have attention deficit disorder even as he grows into an adult. So there is a possibility that he might need to continue with some amount of the medication for as long as he feels is necessary. So you have to realize something also. A kid very often doesn't have a choice. An adult does. So before we start things, even in kids, we have to be very, very careful, because, if you are an adult and I give you medication, you can just refuse to have it and throw it away and all of that. If the kid does that, his mom and dad are going to beat him up. So we have to be very careful before we actually start the medication. As you grow older and you see the difference in your life that occurs when you're on medication and therapy or whatever, it's very likely then that you will not want to give up the medication. But I've had a huge number of people who have given it up. Say they've taken it for about 10 years, 15 years, and they say, let me try without. Some of them try without, they manage. Some of them try without, and after the year, they come back and they say, I want to get back onto it. Because the difference that I have seen when I am on the medication, I'm so much more productive. My boss loves me, etc., etc. And when I'm not on the medication, I start snapping and snarling at everybody. I don't finish work. I procrastinate crazily. I can land up losing things, which is not acceptable in my office. So please put me back on medication. So it's very difficult for me to absolutely state a yes or a no, but the tendency would be towards it continuing for the rest of your life. Avinash.
Okay, coming to the issue of friends, see what I have seen in my experience is that children, adults, adolescents with ADHD, they make friends initially. It's not that they don't make, but they generally can get very upset or impulsive if something goes wrong. So that ends up in a fight that sometimes spoils the relationship. Even in conversations, they very often speak out of turn, or they butt out of turn, and they interrupt other people's conversations, don't allow them to finish. So that causes impediments to their social communication, and friends slowly move away from them. Sometimes they may not even understand the emotions another person is going through. And if someone is talking slowly, they may want him to hurry up because of their own speed. And this also causes a problem. So I always believe that one of the elements in the therapy for ADHD, of course, in combination with medication, is we have to train them a little socially. We have to train them how to be, where to be, what to say, what not to say, how to comprehend language, how to comprehend emotion, how to comprehend sarcasm. Multiple things is what they need to learn. So that is part of the sort of psychotherapeutic aspect in ADHD. And if that is done, then they're able to sort of make a few friends. So if any child, adult, adolescent with ADHD is having problems in making friends, I think going to a therapist who would help them would benefit definitely. Yeah.
Sachin, before you go ahead, I'd just like to talk about what Ashish Kejriwal has written. And thank you, Ashish, for writing this. He writes that he was affected after he was diagnosed with schizophrenia. Attention was badly hit, and I would ask for tasks to be listed in text message with approximate deadlines, which helped him manage through all the tasks in a timely manner. I'm very pleased you said that, because we have to realize that attention deficit by itself is a part of what could be other things as well. So you can have schizophrenia with attention deficit, you can have bipolar with attention, or you can have schizophrenia with no attention deficit. Attention deficit could be by itself, it could be associated with other things. Given the fact that you mentioned this, I'd like to say what I think some 5 years ago, Avinash had actually interviewed me about school psychiatry. We had done a whole thing, and I realized that I have worked with about 6 or 7 normal schools, universities dealing with special kids. I've worked with the Spastic Society. I've worked with the first learning disabled school School for Learning Disabilities in Bombay, blah, blah. So one of the things that I had done ages ago, I went to a normal school and I told the teachers, because I was doing a program for teachers, I said, you're going to have about 12% of your kids who are going to have attention deficit, whether you like it or not. And what happens is you're writing stuff on the board. By the time you come down to the end, then you say, okay, I'm going to rub out the board. A kid with attention deficit would have gone through only half. So then he's going to lose out on whatever else is written. And then he gets aggravated, he gets agitated, and then he becomes more restless and he disturbs the class even more because, okay, now he's lost continuity. So what do? We divide the board into two. You draw a line through and you divide the board into two, and you write on the left-hand side of that compartment. You reach down, you start on the second part. So even if the kid is slow, he comes down to the end. You might be halfway through the second part, and you say, okay, I'm going to rub out now the first part. And he has the time. Small little environmental decisions, small little environmental quirks can make a lot of difference to the kid's life. See, eventually, I used to love that old saying, if education does not help a kid, then what are we doing as educators? If we somehow cannot get our children to understand, there's something wrong with us, not with them. And I'm certainly not saying that every kid with attention deficit is going to become brilliant. But I'm certainly saying that every kid with attention deficit has the right for us to look at him like he's going to be a brilliant adult. And that's not going to happen if he'll end up saying, oh, get out of here, go to a special school, you're a pain to be with, and things like that, which are also known to happen. Over to you, Sachin.
No, that's a wonderful perspective. I was just thinking, what you said and what Dr. Avinash mentioned. Shalinee, do you have any thoughts of your own?
Yes, what he said was exactly right. There are just so many struggles that we have on a day-to-day basis. And, it's not like we are mad. It's not like, there's some issue with us. It's just that our brains are actually wired differently. And we actually have to have a lot of patience in ourselves, with ourselves, to just become the best versions of, ourselves.
Thank you. Akhila ma'am is asking, can ADHD adults get technology to focus?
Well, there are a number of computer-based programs which are used in the management of ADHD. And what happens at times is sometimes certain computer games, video games, which are distracting, violent, aggressive, can aggravate symptoms of ADHD. But at the same time, we have a number of computer-based programs that help to improve focus. And these are cognitive psychology-based programs, which are available online, and they are marketed by companies in India and abroad. They're pretty cost effective. So it's something that can be done at home. And we normally advise children to do them on a laptop rather than do them on a mobile phone or a tab, because the distractibility is far less. And children do benefit from that. So there are computer based apps or computer based games that can be beneficial. But of course, it varies from individual to individual. So one will have to look at the pros and cons, because I remember whenever we suggest anything online, the parents often complain that he's already on a gadget for so long, or he's already on a phone, on a tab for so long. So we want him to not be online. So can you suggest something offline? But in the fast paced world that we are today, sometimes you may not be able to go offline to a therapist 2 or 3 times a week. So you can go probably once in 10 days, and at least 9 days, do something online cognitively, which would help. So that would be my take. Yeah.
Yeah, thank you, Dr. Avinash. Any suggestions from your side, Dr. Kersi, Shalinee?
No, I think what Avinash has said, I agree with. I certainly think that there is a role that computers can play, and we don't have a choice now. Anyway, artificial intelligence is going to play a bigger and bigger role in whatever we are doing in the future. So we have to use it productively. There are certain things, like Avinash said, which can be counterproductive to what we are trying to do. So we have to be aware of it before we tell our kids what to do, which means we have to keep up with the latest as well, which sometimes is difficult because they probably know much more than we do, at least in that way. So we have to. I mean, Shalinee, I'm sure, knows much more than I do related to digital stuff. So maybe Shalinee should answer. Did any
Yes.
Yeah.
No, sorry. I mean, if you want, you can just complete the sentence. All right, thank you. Yes, I think technology in today's world plays a massive role. I mean, I just can't be grateful for how helpful ChatGPT has been, how helpful YouTube has been in today's times. I mean, there are certain things, certain emotions that which I actually cannot help understand. But that's when I reach out to different platforms. I listen to different podcasts, and everything is online. So yes, technology has played a major role in helping me survive ADHD, and I just cannot be grateful for this technology for helping me understand this version of myself that I didn't know existed.
Oh, thank you. I think this has been a wonderful conversation. I think from two experts and with one person with lived experience. I think very grateful for these thoughts. There's a clinical question from Sudeepa Das. What are the difference in symptoms among ADHD and bipolar among adults? So this is one question. One is, can self-harm be an ADHD symptom? And from Mr. Kale, can ADHD exist along with OCD and the same medication work for both? So first is bipolar and ADHD. Second is a self-harm question. And third is, can ADHD exist with OCD? And would the medication work for both?
Okay, so I will start with the first question. I think the second and third, Dr. Chavda can answer. The first question is that ADHD and bipolar are two distinct disorders. Like we discussed in ADHD, inattention, hyperactivity, fidgetiness, impulsivity, social issues are things which come up. Whereas bipolar disorder is something like what we say in Hindi as kabhi khushi, kabhi gum. So you have, phases where there is bouts of depression, and then there are phases where there are bouts of elation and high mood. The two disorders can exist together. So you can have a patient with bipolar who has ADHD also. Also, like I mentioned, the fact that you have ADHD which progresses into adolescence and adulthood puts you at a higher risk of a mood disorder, that is depression or bipolar. But bipolar patients can also get manic in the sense they may spend excessively, sleepless, they get hypersexual. These are symptoms which you don't see in ADHD. And the depressive phase is a low phase where you feel sad, you feel life is not worth living, you feel upset, you feel that you're not able to focus. So the problem is attention and focus gets affected, whether you're elated or whether you're depressed. So the symptoms overlap with ADHD, but the two are separate disorders. I think self-harm and OCD, Dr. Chavda can answer. Yeah.
Okay, so I don't think self-harm is a symptom of ADHD. There's something else that's happening. I don't think attention deficit is associated with your hurting yourself. So there's some comorbid thing which is happening. Like I said, attention deficit is usually associated with other things. So I think there's something else that needs to be looked at when you cut yourself or you harm yourself in some way. Can you do the OCD thing with, what is that? Yeah, can ADHD exist along with OCD and same medication will work for both? Yes, it can. Attention deficit can exist with OCD. It's very unlikely that it's the same medication will work on both. So you're going to have to give combinations of medications, something separate for OCD and something separate for ADHD. Therapy for both would be beneficial. So a combination of therapy with medication is what we would recommend at this time.
Yeah, thank you, sir. I think there's a feedback by Sudeepa saying that the Blackboard example was very good, which Kersi sir gave. There is a question from Suresh sir asking if diagnosed not clear and loved one is in denial and have an aggressive personality, how to deal with it. So this might not be ADHD, but this is like a general question which has been asked by Suresh sir. And then Ishika is asking, I'm studying for an exam, but for some weeks I'm unable to focus very well. And then after that, I can't get to study even if I want to. So I'm not able to be consistent. How can a person with ADHD get over this problem?
Okay, so I'll go with the second question, that when we very often get people who come before an exam and they say they're unable to focus, we at times go with the clinical diagnosis because we may not have the time to do an intensive assessment considering the exam is a week away or 2 weeks away. Sometimes we even start them on medication for that period because we do not have time to even look at a therapeutic approach at that time. But what we tell them is post your exam and the attention focus improves by around 20 to 40%, 50% at times. But we often tell them to come back post exam and see us, which is very, very important. But most people, once the exam is over, do not come back because I think their need for attention and focus goes off. And they even stop the medication on their own. So the disorder remains untreated till again they come to the next exam. And the next semester they are back with the same issues. So invariably this happens in the month of Feb. They come to you in Feb or March and the exam is in March end and you treat them. And then no one comes to you in the May vacation because no one wants to go for therapy or treatment or anything. And then again, next year, October, in the exams, they'll again have a problem, they'll come. So this does happen, but they ideally need to get themselves assessed, diagnosed, treated, and therapy done properly. Well, I think the other question was about aggressive personality, and I think they need to seek help. That much is what I'll say. Anybody who has somebody who's aggressive, short-tempered, it doesn't matter. Please, one very important facet that I want to clarify here, and it's very important. I think Dr. Chavda will agree with me that you don't have to be ill to go to a psychiatrist. Okay, that is something which a lot of people have a myth that if I have a problem, I will go to a psychiatrist. No, a lot of normal people, absolutely normal individuals who are battling with a tough boss, a tough wife, a tough mother-in-law, they also come to us to seek opinions. So it's not that we're only dealing with those who are ill. It's high time that we need to give more candor and glamour to mental health like you all are doing. So people need to realize that normal people go to a psychiatrist, and we also are fathers, brothers, uncles, we're also as normal as you are. We're not sitting here to just diagnose and put pills down your throat.
Let me add to that by saying doctors also go to psychiatrists.
Yeah.
So I have a huge number of doctors coming to me. I have a huge number of industrialists coming to me, as does for Avinash and my other colleagues. and these industrialists run the economy of India. I have cops coming to me, and they're responsible, hopefully, for keeping law and order in our country. We have politicians coming to us for their own problems. So we have gangsters coming to us, because even if you're a gangster, you still have the right to be depressed once in a while. So all of these things do happen. It doesn't make them abnormal. It just means that, just like, it's like saying that a cardiologist should not have a heart attack. Of course not. Of course he can. So a psychiatrist can be depressed and anxious. What's the big deal? But then they come up to us and say, but how can you have a problem? Well, I have a problem because I'm human. So everybody who comes to us is human. They're not ill. I mean, they may have an illness, but that doesn't make them weak. This weak thing drives me crazy. Would you be weak if you had diabetes? Would you be weak if you were hypertensive? Why on earth, if you are weak, would you be considered weak if you had depression or anxiety or attention deficit disorder or even something like schizophrenia or bipolar disorder? You're not weak. You just have a problem. Deal with the damn thing. Come to us. Take treatment. One way or the other. Become okay. Become more productive. Stop considering that it's the end of the world. Okay, now I'm pontificating, which should not happen. But let's look at life a little differently. And it doesn't mean that if there is an illness that makes you weak, that makes you useless, that makes you a burden on society. Yes, you're a burden on society if you don't take treatment. If something is available for you and you choose not to do it because what will people say, then get over what those people will say, take the help, and then those people will not say anything. Cheers.
I mean, I will just add one point. I always remember when I have suggested medication for ADHD for particularly adolescents and children. I've had many parents who asked me, sir, अगर आपके बेटे को ये तकलीफ होता तो क्या आप देते? And I would say मैं definitely देता, क्योंकि और मैं तो अच्छी तरह से जानता हूँ कि इलाज क्या है, तो मैं सब इलाज कराता, very often even people who come to us with depression or any other simple problem like anxiety, they say, so would you take an antidepressant if you're depressed? And I said, definitely I will. I said, it's like if I have blood pressure, I'll take an antihypertensive, or if I have diabetes, I'll take medicine for diabetes. So if I feel depressed, maybe I'll take an opinion of a colleague and say, okay, I'm feeling low and should I take this tablet or that tablet? And I said, I will start, but there is no need or no reason for me to feel ashamed. I said, I prescribe to the world, so I can certainly treat myself. I say, if a physician who prescribes treatment for malaria will take anti-malarials if he's having malaria, he will not say, no, I won't take it. So that is something I think which is very, very important. Someone has written that they like my tip about planning breakfast. I'm very fond of food, so I plan breakfast one night before only, always.
Shalinee, your perspective, your journey on
yes.
seeking.
What I want to know from Shalinee, I'm going to ask you a very simple question, is that what I want you to tell the audience is that how has your journey with ADHD transformed you as a person? What are the positives that you've encountered? Just a few points. It will encourage a lot of people who are, here.
Sure, yes. Firstly, thank you for asking this question. It's not something that I talk on a daily basis unless someone actually brings up this topic. It's very important for us to, understand ourselves much better. I think 90% of my life, I had not realized that I have ADHD. And when my best friend told me about this, it just actually made a lot of sense. So for me, I actually have had a lot of anxiety. So for me, a discipline, a routine is so important. Like you also rightly said, it's very important for you also to plan your breakfast in advance. I am typically the same. It's not just for my breakfast, but for my work. I'm such a person, if anything goes disorganized, I just burst. I just go mad. So for me, a lot of my personality is actually about, how I have routined my stuff, how my life, after I've realized that I have ADHD, how my life has actually made sense to me, because overall I have a structure to it. And I think different techniques like, coping up with it, which is typically educating myself on a day-to-day basis about, what exactly, what other things I can inculcate in my practice, which I'm currently not. I sometimes take therapy when it's actually required, because sometimes it just becomes difficult for me also to understand that a certain way, like, if I've had a fight with a very important person, I just, go all haywire. So sometimes I actually need professional help, which is very common, and it's very important also at the same time. Then it's just that, we have a lot of energy in ourselves that if we don't release it or channelize it in the right way, we sometimes just end up losing it. So in terms of those things, I have made sure that, I exercise at least 6 times a week. I do something that I love. We are also very passionate people, so there's some kind of hobby that I love picking up on. There's something or the other that just goes on in my head. It's just like, we have 10 browsers open at the same time. So in terms of positivity, I just cannot it's actually, since I've started seeing the positives of it, since I've started seeing it as a strength, I just think my personality would be way different if I did not have ADHD. And it has just brought, at work, I just excel. In the previous team that I was in, I was a top performer, and currently also I'm doing very well. So it's just that if I don't think I had these certain things which has made me the person that I am, my life would be different. And I don't know, what it is to live a normal life. But this is something, this challenge is actually, it's an eye opener for me, and it's something that I love, learning about life, learning about different things every day. So this is what keeps me motivating, and which keeps me hustling and striving for looking forward to life every day.
Okay. Well, I will add only one point that, with school children with ADHD, one of the things which we have done is that we have made small printed checklists for the student. So we have said, before you leave the class, water bottle, pencil box, desk, so they keep ticking and they keep checking so that they don't forget anything. And once they check, they just tear off that chit for the day. And so a chit block of 30 days is made for 30 days. So they will keep checking every day that they don't forget anything. We also tell the teacher that he's forgetful. So if you want us to do something, put a small note in his bag tag, which has his name on it. So a note is put in there, and the mother will check later what the note is, so that she will come to know if anything has to be done. Or we tell the teacher that we can have a small notebook which will go back and forth. So you can write what I have to do, and I will also write if I have to tell you something, so that communication can, rather than SMS or rather than use WhatsApp, this is something that can be done very easily. I'm not taking over from Sachin, but I have another question to ask Shalinee, and that is that during your journey, was there any particular book, any particular quote, or any particular person? You need not name the person, but that said something that transformed you. I think it will be an inspiration for people who are listening.
Definitely. So there is this online coach. She's from the UK. She also has been diagnosed with ADHD. So she keeps sending me these e-modules over my mail, which I actually didn't know what important part of, breath work was required. I didn't know a ton of things until I started educating myself about this. And I've also had the opportunity to connect with different people, like even in my workplace. We are slowly encouraging that people with actually this disorder come out, they call it out, and so that it will help other people understand that what it is to live with this struggle every day.
Yes, I
So
agree.
I think yes.
No, I agree. I agree
Yes.
totally. I always say this one sentence, that the single most protective and important factor in workplace mental health is an understanding boss. If you have that, then automatically everything. I think there's a question that Dr. Chavda can take up. Sachin, you can read it out. They were asked about the cause of ADHD.
Yeah, I think what is the single biggest cause of ADHD?
I don't think there's a single biggest cause, but we do know it runs in with genes. So there's a genetic thing. It's very likely that if you have a family history, then the chances of your having attention deficit increases. At one time, we would say it's more in boys and we don't find it in girls. Today, we know that's not true. We have a huge number of girls also having it. Then we look at a whole bunch of things happening in the brain, but that is not, and I don't know what you really mean by a cause of ADHD. It's a genetic thing, you're born with it.
Wonderful. I think very grateful for this sharing, I think, with two very eminent psychiatrists and one person with little experience.
Sachin, I love what Suresh has written. He said, as a caregiver, challenges are huge.
Correct.
What after us is a big question for us. And I would absolutely agree. I think it's essential for us to be very realistic about the fact that in today's generation, however much a sibling might want to look after another sibling who has some kind of issues, it may not always work out. I think it's necessary for us to make a trust. I think it's necessary for us to keep finances appropriately done so that it cannot be misused. And if the guy is a little naive about finances and can be used by people, unfortunately, we see a lot of that happening. Let us ensure that you put in safeguards. There are a number of legal issues that can be done, setting up a trust, having a certain amount of money coming to the guy, ensuring that the house remains in the person's name, ensuring that the will is taken care of. This has always been a problem. I mean, I started practice 40 years ago. That problem still persists even today. And unfortunately, with all the corruption and all the the nonsense that happens, our kids are actually more vulnerable probably than what they were 30, 40 years ago. We've got to be realistic. We've got to do whatever we can to safeguard their interests. So I'm so glad that Mr. Suresh has brought this up. There's no magic mantra. You have to start today. Do whatever you can. I mean, it depends on the person. Now, for example, somebody who's functioning very well, you may not need to do much. But somebody who, in addition to having attention deficit disorder, also has, say, an intellectual difference and really can't look after himself, you need to set up a trust for him. You don't have a choice. Otherwise, he's going to be misused. He's going to be, land up having major problems. We have to expect the worst and work towards the best. That is my dictum for everybody. Thank you. Thank you, Suresh, again. Okay. One of the best questions asked. And I can see you waving. You want to say something?
Yeah, something. See, Dr. Kersi, first time I have seen you, and Dr. Avinash also. This is amazing. I see a lot of experience, a lot of traveling I've done in NAMI USA also. I'm a member of NAMI USA also. But Saraswati and Sachin, they have created so many things within a very short span. I'm really happy to be with this group. And if we can do something which is based on humanity, see, empathy is okay, but humanity is day by day, it's getting scared and this one. So that, and Shalinee has done a very fantastic job. Only what we compare with her is, if my son, who is 44-year-old, can do the same exercise, have the same insights and education, things will turn upside down. That's what. And if we can do that, then that will be a great journey, golden journey will be. Thank you, sir. Dr. Kersi, Avinash.
Thank you, sir. Thank you for sharing, and thank you for your very nice words. I hope that what you hope will happen actually does fructify into something. And I have no doubt that NAMI and FAVMI will do the best that they can. And we are always there. I mean, we'll also
whenever NAMI needs us, we're there.
We'll also get old and Buddha and we'll forget who we are talking to, but what the heck, we'll still be there.
Thank you, Sureshji. Thank you, Dr. Avinash, sir. Thank you, Dr. Kersi, Shalinee. Can I just request one message? So we had the additional director for mental health. And would you just leave one message for the state of Maharashtra? What she must have left and she'll rejoin. But as psychiatrists who have seen this journey for so long, and Shalinee, from your side, what could be done for ADHD at a very programmatic level?
Well, I will leave just two small points. That one is, I think, when we traverse the city, we see so many advertisement boards, and we see liver transplant being advertised, lung specialists being advertised, pulmonary care, nursing care. I think if the government and hospitals can get together and advertise mental health, people will be more accepting of it as a specialty. And the second point is, we have to work towards developing mental health friendly institutions. If institutions, schools, colleges, etc., are mental health friendly, then I think a lot of our burden will reduce. Yeah, Dr. Chavda can.
I got a little scared with Sudeep's thumb. I thought you were going to come and hit us or something. Okay, so I'd agree with what Avinash has said. In addition to that, I'm looking at two other things. Number one, I would believe that, I'm from Mumbai, so is Avinash. And I think we are doing much, much better work in our metropolis in comparison to maybe what exists in other parts of the country. And eventually an Indian is an Indian wherever he is. So I think it's essential for all cities, all states to focus a little bit more on mental health. I know that in the South, there's a tremendous amount of work happening. We have some fantastic institutions, even in the North. But a lot of psychiatrists are under a lot of stress. And we have to remember also that mental health is going to affect everybody. We have to get over the stigmatization that people have talked about. We have to be in a position where if I go to a party, I can very proudly say, he's my doctor. And that has started happening when I've gone to places. I've actually gone to a show and somebody on the mic got up and said, "Hey, Dr. Chavda," and he announced to the crowd there that Dr. Chavda is my psychiatrist and because of him, I'm alive. We need more and more. I'm not talking in terms of myself. That is not important. We need more and more of people to come out and say that psychiatry does make a difference. I'm passionate about the subject. I cannot think of being anything else. When I was a medical student, I could have done other postgrads. When we started, it was not looked at very positively. Avinash's dad was head of department of psychiatry in one medical college. Avinash's mum was head of psychiatry in another medical college in Mumbai. The poor chap had no choice but to become a psychiatrist. His son is going to become a psychiatrist, I'm sure. Oh God, can you imagine the number of Desousas who are psychiatrists? Bottom line, it's a huge problem. It's a huge circumstance. I'm a psychiatrist. Every single morning I wake up saying, I wish myself and all my friends good mental health. And we've got to do that. We've got to normalize mental illnesses. We've got to treat them with respect. We've got to fight for their rights because it might also happen in our families. Thank you.
Just one thing to add. I think both of you, whatever you said was very correctly said, because yesterday, before I sat down to prepare this PPT, I was just discussing with a friend, that why am I doing this and how did this opportunity come up to me? And what my friend told me was that why don't you speak about it more often? Why isn't there much awareness amongst people, our age or just in general? So I just said that this is the lack of awareness is actually a thing. Not everyone is comfortable speaking about it. I'm not really sure how the other person will like to take this. It's just that, while I'm very grateful that I got this opportunity, but I think there are n number of people out there who actually don't understand that they have it. And if you look at statistics, there are actually people, at 40, at 50, they just get up, and probably they've read the news or something or the other. Once I think they get some kind of education on mental health, that's when they actually understand that, oh, this is something that I've always had. So I think this lack of awareness piece is actually real in today's world. And while I was speaking to my friend somewhere, I also thought that he also has ADHD, because since I know him personally, a lot of his personality is based upon the actual symptoms of what ADHD looks like. So what I suggested him is that you can just take a diagnosis. Either you can have a word with any psychiatrist, or do some kind of uh, hard work to understand that what you're thinking in your head, is it actually some challenge, do you actually have ADHD or not. So I think this, people should actually try and help and educate themselves, probably attend more forums like this, so to help understand themselves better and others also. And if there's the one takeaway from this entire call, is just that ADHD is not actually a weakness, it's a different kind of power. Once you stop fighting your brain and start understanding what it is, there's nothing in this world that you can't do.
I'll just like to add on is that, when we were trying to do this conference and trying to get an ADHD warrior, a lot of people refused. And I must thank Shalinee from the bottom of my heart that she agreed to come up and speak about it. It needs a lot of courage, and a young girl like her. And I have just met her in a restaurant very informally a couple of months back. I don't even know her too well. And, the fact she's agreed to be on this show, thank you so much. A big round of applause to you, Shalinee.
It means a lot. Thank you, everyone. I mean, for this informative session, there are a number of things which I also learned from this session, to be associated with different kind of founders, and the root cause of why we are doing what we're doing, to be associated with such a cause, is actually very commendable in ourselves. I mean, all of us could have just led a simple life, doing our jobs, doing our corporate jobs, or doing what we were doing, but leaving that and stepping onto something to face these challenges, to take on something which is not so regular, is actually truly mind boggling. So thank you for everything.
Thank you all. Thank you, Dr. Avinash, Dr. Kersi, and Shalinee. I think very grateful for the wonderful sharing, and thank you all who joined for this session. We'll reconnect back at 11:30. Thank you very much for all the wisdom shared. Thank you.
Yes.
Very great.